Hello, everybody. Laurie, Seavey here from IMPACT Melanoma. How is everybody doing today? I hope you're staying safe during these times of COVID-19 and also sun safe as well. I want to thank you for joining me today to learn how IMPACT Melanoma can help you bring free sunscreen educational programs to your community. Today, you will meet two amazing community partners. I will show you our sunscreen dispenser, the variety of display boards that we offer, the marketing platforms that we use to bring brand recognition and awareness to your organizations. We'll have a Q&A at the end, so if you have any questions, please make sure you type it into the chat below. So let's have some fun. For those of you who are not familiar with IMPACT Melanoma, we're a national nonprofit organization dedicated to reducing the incidence of melanoma, committed to skin cancer prevention, and we do this a variety of ways through our award-winning educational programs, which aim to raise awareness and educate the public about skin cancer. In 2014, the Surgeon General touted skin cancer as a major public health epidemic, and IMPACT Melanoma jumped into action and answered that call with our Practice Safe Skin program, which I've been managing now for about 4.5 years, where we bring sun protection programs, education, and of course, our sunscreen dispensers to communities across the country. We work with hospital systems, cancer centers, public health departments, and individuals passionate from across the country that have either been affected by melanoma themselves, maybe they're a survivor, or family members that have been affected by a patient or family member that's had melanoma. So we work with not just organizations and cancer centers, but individuals that are passionate about our mission and our purpose. During COVID-19, as we are all trying to get outdoors, we know that the safest place to be is outdoors. And while we're outdoors, we wear masks, we practice social distancing, we make sure that we're utilizing proper hand hygiene, but we also need to be very cognizant of the fact that we need to wear sunscreen while outdoors every day. It's just as important. So I'd like to introduce you, joining me today are some amazing community partners, both Kelsey Magnuson and Kelly Sugihara.
Hi, ladies.
Hey, everyone.
Hey, long time. I haven't seen you guys in a while. It's lovely to see you.
You too. So glad to be here.
Thank you. Thank you for joining us today. Kelsey, why don't you start off and tell us a little bit about your organization and about yourself?
Yeah, I'd love to. Hi, everyone. I'm Kelsey Magnuson. I'm the Community Benefits Coordinator at Emerson Hospital, located in Concord, Massachusetts. Emerson provides medical services to more than 300,000 people in over 25 towns. We're a 179-bed hospital, and we have more than 300 primary care doctors and specialists, and we care for everything from arrhythmias to wound care. And our core mission has always been to provide high-quality health care and make it accessible to those who live and work in our community.
Thank you. Thank you for that introduction. Good morning, Kelly. Hi.
Good morning.
How are you?
I'm good.
Good. Why don't you tell us a little bit about yourself and your organization?
You bet. My name is Kelly Sugihara. I'm with the Wyoming Cancer Resource Services Region 5, which I serve 5 counties, Sweetwater, Sublette, Teton, Lincoln, and Uena County. And I wanted to share with you a little about the why and the reason I'm here today. I come from a sales background and banking background, but while I was managing the bank in 2017, I was diagnosed with stage 1B cervical cancer, which led to surgeries, radiation, chemotherapy. And after I completed my cancer treatment, that's really when my cancer prevention work began. Wyoming Cancer Resource Services, which is funded by the Wyoming Department of Health, is a great organization, and that's when I began my journey on cancer prevention. And as I was writing and we were reviewing a little bit about our program, my mom contacted me on July 9th to state that she had skin cancer. She's had a small surgery. She's doing well, but all the more reason for me to continue and grow my sunscreen initiative.
Thank you. Thank you for sharing your story. We hear this all the time. We hear people that we're currently working with will hear that, one of their loved ones has been affected with skin cancer. And, one other thing we also hear is it's just skin cancer. And, melanoma is the fastest growing cancer in the United States. In reality, melanoma takes the life of one person every hour. And to be honest, this is just one too many. Sunscreen is a vital part in prevention. A regular use of an SPF 30 reduces your risk of squamous cell carcinoma by 40% and melanoma by 50%. In this past decade alone, between 2010 and 2020, the number of new invasive melanoma cases diagnosed annually increased by 47%. So sunscreen is a vital piece of our sun protection program. And, that's why we say here at IMPACT Melanoma, SPF is your BFF. So, so Kelsey, why don't you tell us a little bit about your initiative and why it's important to Emerson Hospital?
Yeah, I'd love to. So Emerson does a community health needs assessment every few years. Our most recent assessment was conducted in 2018, and it revealed melanoma being in the top 6 highest cancer prevalence in our area. And so melanoma is part of our larger health priority of addressing cancer rates through education, prevention, and early detection. And in response, Emerson reached out to IMPACT Melanoma to form a partnership with the aim of reducing melanoma rates in our area. And a key program of the partnership is the SunSafe program, where we are installing sunscreen dispensers throughout our community. As we launched the program last year and had success with the partnership of, establishing relations with our towns and also the high utilization of the dispensers. So this year we started the process with an invitation to recreation departments and local public health departments to come and hear more about our programming and what we wanted to do different this year. So we got some towns on board, and we did get delayed because of COVID-19, but we're very excited to be able to install 16 dispensers before July 4th. And that was really exciting to get our dispensers out at high traffic areas, places like parks and beaches. We have a pool and other recreational areas. And anecdotally, we've heard from last year and now this year that we've been doing the program that people oftentimes will put sunscreen on at home, but then while they're out, they want to reapply. And so the dispensers are a great way to do that. And other people tell us that they just simply forget to put it on at all. So when they're out at these public places, they have the opportunity to be able to put on have sunscreen and have access to it, which is really exciting for us. And we're just really excited to work with IMPACT Melanoma to make sure that people in our surrounding towns can have fun this summer, be outside, but protect themselves from skin cancer.
Thank you, Kelsey. You touched on some really important topics. I just would like to elaborate a little bit more on. COVID-19 has kind of derailed us a little bit. I think everybody, right now, but we were able to get these programs off the ground. But as part of our Practice Safe Skin program, we conduct sunscreen surveys pre and post program. Over the last 2 years, we conducted some research studies in New York, Los Angeles, Vermont, South Carolina, just to name a few. And of that, 59% reported that the barrier for them to not wear sunscreen while outdoors for 20 minutes or more was that they forgot. And of those surveyed, 74% said that they would use a public sunscreen dispenser. So, what we're really trying to do here is to prevent the burn. We know that prevent people from being outside and burning, because we know that burn is a risk factor in developing melanoma. And as we enter communities across the country, we use our sunscreen dispensers really as kind of the lead in as to the tangible piece that folks can see. And then we wrap our educational programs around them to really create a grassroots feel. We know at IMPACT Melanoma, we've been doing this for 20 years, that comprehensive sun protection programs need education backing them. And those have been the most successful programs that we've been working with across the country. So thank you so much, Kelsey, for that. Kelly, why don't you tell me a little bit about your project?
Okay, I just have to piggyback on something that you stated. So recently my husband and I were out at the lake and I applied his sunscreen. Well, I missed a few spots. So it was a little blotchy. It was absurd. I felt so bad for him. But it just reiterated how important it is that we do apply our sunscreen and the benefits of that. So he's recouping from my lack of proper application. But I just wanted to piggyback on that because, yeah, it is so very important. So I'm going to tell you a little bit about my project. It actually started at the state level with my amazing director from the Wyoming Cancer Program out of Cheyenne, Wyoming, Star Jones. They worked with IMPACT Melanoma to bring dispensers through the state parks in the upper region of Wyoming. So I thought, well, why not bring it here to Sweetwater County? So Sweetwater County, Wyoming is home to about 29,000 people, give or take. We currently have 12 sunscreen dispensers located at a handful of splash pools, multiple golf courses, splash pads, and pools. I collaborated with both the city and Parks and Rec Department. They are my biggest partner by far. They install, repair, and refill the dispensers for me. The Wyoming Cancer Resource Services has a grant that provided me funding to be able to purchase the dispensers and the sunscreen this summer. So my next goal is to start rounding up sponsors and community members to help make this project sustainable for years to come. That is when my partnerships come in with IMPACT Melanoma. They help to provide me with sponsorship agendas along with swag, educational material. I could not have gotten this project off the ground without these three resources. As my project grows throughout this summer, we have long winters here in Wyoming, which allows me to be able to kick off next year even bigger and better. I would like to see my project extend throughout my other 4 counties. So as I move forward in this project, my ultimate goal is to have 5 counties sustainable within the next 2 years. So I got a little work ahead of me, but I'm looking forward to continue to grow my relationships and bring those services to Sweetwater County.
Thank you. Thank you, Kelly. So Star Jones, she really was a pioneer in bringing sunscreen dispensers to state parks. I believe Star was the first person in public health that I worked with to bring sunscreen dispensers to state parks in Wyoming. She had a great vision. We now work with state parks in Pennsylvania, Vermont, and Kim Nelson, who's also part of your organization in Wyoming, has brought sunscreen dispensers to her county. So I think Wyoming now has about 70 to 75 sunscreen dispensers alone for this project. So congratulations. Another really important point you touched upon was collaboration with Park and Recreation. Parks and Recreation are really instrumental in partnering with our programs because they're really the host sites, right? They're really where folks are outdoors, enjoying being outdoors, being safe, having healthy lifestyles. And our state parks and our park and recreational sites are wonderful partners as well. When we work with state parks or even municipalities for that matter, we are able to weave in additional resources that IMPACT Melanoma provides. So we have a Safe Skin at Work program. So we can kind of enhance the experience at the parks because outdoor workers have a 65% increase risk of developing skin cancer because of their excess exposure being outside. So it's nice that we can provide the sunscreen dispensers. We layer it with education for outdoor workers. We get their buy-in, and they also help us maintain these dispensers when they can at their site. So thank you so much for that. And Kelsey, so your project was funded a little bit differently. Would you like to explain?
Yeah, I'd love to. So our project is primarily funded through Emerson Hospital's Community Benefits Program. Emerson is really committed to working with our community partners to improve health status of everyone. We want to address those root causes of health disparities and educate the community in prevention and self-care strategies. So this is really hitting all of those areas. And as I mentioned previously, cancer is one of our priorities that we're trying to address with partnerships and our community funding. Additional support does come from our partnering towns, and also we got a personal donation from the Celebrating Emily Fund. So our dispensers located in Westford, Massachusetts are in tribute to Emily Edwards, who was a beloved mother, wife, daughter, and friend who passed away last summer. Emily really cared for all people and fought for her values throughout her life, and specifically over 7 years of fighting melanoma. So Emily's husband, Matt, launched a campaign fundraiser to help make sure that Emily's life was celebrated, and she was able to give back to things that were important to her. When we learned about Emily's battle and the efforts that her family was taking to give back to the community, that really hit us home on a personal level last year. As we've been talking about, it can be easy to downplay the use of sunscreen or even concerning skin spots, but that it can be perceived as they can just easily be removed. But melanoma really is something to be taken seriously and addressed.
Yeah, it was. Matt Edwards is really instrumental. Matt contacted IMPACT Melanoma. We get inquiries from across the country from people that have been affected, such as Matt losing his beautiful wife Emily to melanoma. We get contacts from people that want to honor their loved ones, and IMPACT Melanoma, we offer services to kind of help bridge and connect the dots. We have community members across the country that we work with, medical students, and we work with campuses, and our programs are now in 42 states, and as of yesterday, 43. We got South Dakota. I got contact from South Dakota yesterday. So our programs really are available to not only organizations but individuals that are passionate about our nonprofit, and also passionate about the cause and the prevention of melanoma. So now that we have a better understanding of some of the components of our program, I'd like to introduce you to Sunny. So this is our sunscreen dispenser that we utilize and have been working with this for, probably about 5 years now. So I'm going to talk about this dispenser just a little bit. So this is our sunscreen dispenser. It's impact resistant. It's weather resistant. It has, it will hold up in extreme temperatures. It's run on 4 D-size batteries. This is a little 4x6, what we call an insert. So this is totally customizable for your organization. This one has IMPACT Melanoma's logo, Emerson Hospital, and Emily's campaign there. We use this for sun-safe messaging. SPF is your BFF. The sunscreen ingredient labels are on the side. We use a broad spectrum SPF 30. It has a shatterproof mirror right here. It opens up with these 2 keys that are universal, and the sunscreen inside comes in a bladder. So this is 1,000 mLs, and you get 4 of these bladders per case of sunscreen. And depending on the location of your sunscreen dispenser, whether it be a pool or a park, you get anywhere between 300 to 500 people, depending on if they're in their bathing suit or shorts and a t-shirt, utilizing these dispensers. The best thing about our sunscreen dispensers, especially right now during COVID-19, is they're touchless. So you can apply your sunscreen, you can use the sunscreen dispenser, and especially during the times of COVID-19, you're minimizing and mitigating all your risk of getting any germs or a virus right now. So we we follow proper protocol with organizations that we work with, and we identify the correct way in which to clean them periodically. So just in case. So also available for your organization are our marketing opportunities. As you can see on Sunny here, he's also wearing a mask. Sunny is encouraging you to be responsible during COVID-19, wear your mask, and also wear sunscreen when outdoors. So this is really a beacon of advertisement. These display boards are totally customizable for your organization. You can put your logo on here. This is one that we happen to use when we're around an area, a splash pad or a pool where kids would be, kind of look at Sunny and kind of think it's kind of an interesting thing, go up to it and realize it's sunscreen and want to use it. So this is just one of our display options. And I think we have a few more that we are able to show you. So just so that you can take a peek at some of our other offerings at IMPACT Melanoma, we have smaller sunnies that you can utilize that can be mounted to any fixed objects. We have a large sun safety tower, which supports 4 sunscreen dispensers. It's portable. It comes with a umbrella, and it's a great beacon of advertisement. We have a larger sunny that we adhere to a pole. And then we have one here at a marina that we really didn't have anything to attach it to, and we just used some wire ties, and it's affixed there for folks to use when they go off on their boats. So just a couple different options for you regarding displays. So I guess I have a couple more questions for the girls. Hello. I guess so. One last question I guess I'd ask each of you is, what is one piece of practical advice that you might give an organization that is, and I'll ask you, Kelly, first, an organization that's just starting out considering bringing sunscreen to their community?
So I would say the best piece of information and advice that I would have is to find your why. Passion can take you a long way. So finding that reason to start off. The next step is to groom the relationships with your key partners, involve them in your planning, and find some key players throughout your counties or cities that have the same goal in mind. Like Kelsey had stated, when somebody's impacted by melanoma, they're usually your best cheerleaders and help sponsor your, or want to help you be successful. So, and then third, make sure that you're in contact with your partners and are utilizing the outlines and tools that are provided by IMPACT Melanoma.
Thank you. Thank you. Kelsey, what tidbit might you offer the folks at home?
Yeah, our project has a lot of moving parts. We're working with 7 different towns, multiple locations and contacts. So my biggest advice is communication and documentation, finding a way to keep all of that in one place. So I've used an Excel spreadsheet, but there are lots of other programs to do that. From the first stages of planning through implementation and feedback at the end of the season, there's a lot of decisions to be made, a lot of information gathering, checking in, and so keeping track of all that, those details and information in one place is really key. And I have another piece of advice too, is to just put in the time and effort to get partner buy-in. We've been talking a lot about partnership and collaboration, and that's really key for this program as well. Success comes from the teamwork, and the more invested everyone is, the more successful the overall impact will be. And this year, Laurie and I were able to go out to our implementation sites to be able to see the installation process and meet with our community partners, because we hadn't really been able to do that this year. So we wore our masks and were able to do that, and we had a really fun day.
Yes, we did. We really did. We had a great time, and it was wonderful to see all the staff. That was the enthusiasm from the staff as we brought the sunscreen dispensers back this year, and they were excited and they were happy to see them. And they said it really was a great tool for them to be a role model to the kids at camp, to kind of talk about sun safety. And so thank you for that. It was great that we had the opportunity to do that together. So I guess we're going to see about what we have for questions. One question, are there other hospitals like Emerson that are using the dispensers? Yes, indeed, there are. We work with Mass General Brigham. They have just 50 dispensers across Boston, Northside Hospital in Atlanta. We're in Piedmont Park and Grant Park, UCLA, Santa Monica Pier, Horizon Health in Illinois, where we have sunscreen dispensers there. They're also doing either virtual or a live skinny on skin presentation. Upstate Cancer Center in New York put sunscreen dispensers at Roseman Zoo. So yes, other hospitals as well. How often should the sunscreen be changed, and is there an expiration date? Great question. Our sunscreen expiration date is 2.5 years. It's actually on the bag here, and there's also an indication light on the dispenser itself when the sunscreen is low and when it needs to be changed. So great question. Can you sell the rectangular space for advertising to fund the sunscreen refills? Absolutely. Great question. Do you offer grants to student organizations to implement this? And if not, what are the costs of the dispenser? Yes, we have a variety of programs. Contact IMPACT Melanoma. We can work with you through our Skin Smart campus. We're a partner for the National Council on Skin Cancer Prevention. IMPACT Melanoma has a variety of resources. We didn't have time to explain them all here today. That's why we go in, we do a needs assessment for folks that contact me. We look at what community partners we have around you, what organizations we have that can assist you, and what organizations and companies that might be willing to fund sunscreen in your community. So yes, great question. Do you need to remove them in the winter? Well, we say if it's not a winter sports arena, I would remove them. Thank you, Matt Seiden. But we work with ski areas. Just as importantly, I think Kelly and I spoke previously that this is not just a summer thing that we need sunscreen. We need to use our sunscreen dispensers when we're outdoors in the winter. The sun's dangerous rays reflect off the snow. It actually magnifies them. So we need sunscreen in the winter as well. So we work with ski resorts. So take them in if it's not a winter arena. I think that might be it for questions. Where in Illinois do they have the sunscreen dispensers? So Paris, Illinois, they're at splash pads and pools. And if you would like some additional information and if IMPACT Melanoma can help you bring sunscreen to your community, please get in touch with me. My information should be in the description below. We'd like to help you bring sunscreen to your community. And, you know, we have been doing this for 20 plus years. So I want to thank you for joining us today. Please contact me. And remember one thing, our team is passionate, our purpose is clear, and most importantly, our programs save lives. So stay safe out there. And remember, block the sun, not the fun. Bye, everyone.
Bye.
Thank you, ladies. Talk soon.
See you later.
Bye.